Namaskar. Today we will study cephalosporin antibiotics. So the cephalosporin antibiotics have the cephalosporin nucleus which contains this beta-lactam ring. So it is called a beta-lactam antibiotic. So this beta-lactam ring is present in the cephalosporin nucleus. And the cephalosporin antibiotics can be classified into 5 generations, and with the next generation the spectrum of activity increases. So first generation with lowest spectrum are cephadroxyl, cefazolin, cephalexin. Then the second generation cefuroxim, ceforamide, cefaclor. Third generation cefixim, cefotaxim, ceftriaxone, cefoperazone. Fourth generation cefepim, cefpirom, cefozopran. Fifth generation ceftarolin, ceftobiprole. And if you see the mechanism of action, it has the same mechanism of action as that of your penicillin antibiotics. All the beta-lactam antibiotics have this same mechanism, and they target the cell wall of bacteria, and the cell wall of bacteria contains peptidoglycan, and the building block unit of peptidoglycan is this one, which consists of N-acetylglucosamine, N-acetylmuramic acid, 5 amino acid chain connected to join to this muramic acid. Then these amino acids are L-alanine, D-glutamic acid and glycine. Then the fourth and fifth are 2 D-alanine molecules. Then this third glycine amino acid is connected to 5 more glycine molecules. So this is the complex known as building block unit of peptidoglycan. So these building block units are joined in this way, in this fashion, 3 to 4 third amino acid of one unit to fourth amino acid of another building block unit, and this cross linking is done by the enzyme transpeptidase and carboxypeptidase. So these transpeptidase and carboxypeptidase enzymes are inhibited by all the beta-lactam antibiotics, including your cephalosporins. So cephalosporins, by inhibiting transpeptidase and carboxypeptidase, inhibit the final step of peptidoglycan biosynthesis by inhibiting the cross-linking of the building block units of peptidoglycan. So this is your mechanism of action. Then if we see the pharmacokinetics, the cephalosporins may be given orally, but most are given intramuscularly or intravenously, that is parenterally, and after absorption they are distributed widely. Some of them can cross the blood-brain barrier. For example, ceftriaxone, cefotaxim, cefuroxim, they can cross blood-brain barrier. Cefoperazone also can cross the blood-brain barrier. And these are 70% plasma protein bound, like your penicillins. These are also 70% plasma protein bound. And when they are highly protein bound, they cannot be excreted because of their larger size, cannot be excreted through glomerular filtration. So they undergo tubular secretion. So they are excreted by tubular secretion. Some of the uses of cephalosporins are septicemia, pneumonia, meningitis, sinusitis, biliary tract infection, urinary tract infection. And the unwanted effects of cephalosporins are allergic reactions or hypersensitivity reactions, just like penicillins. Then local irritation, nephrotoxicity, diarrhea, coagulation abnormalities, mainly bleeding. And cephalosporins are contraindicated with alcohol, or contraindicated in alcoholics because of disulfiram like action which produces a unpleasant sensation in the alcoholics. And as we know, the ethanol is metabolized to the aldehyde acetaldehyde, then acetaldehyde further metabolized by aldehyde dehydrogenase to acid or acetic acid, and then it is excreted. And cephalosporins inhibit aldehyde dehydrogenase, so they cause accumulation of aldehyde, that is acetaldehyde, which cause disulfiram like action. Then, as you know, these cephalosporins are beta-lactam antibiotics, so they can be degraded by the beta-lactamase enzyme produced by the bacteria. So we can use beta-lactamase inhibitors like clavulanic acid, olivinic acid, sulbactam, tazobactam, along with cephalosporins. And here are some examples: cefotaxime plus sulbactam, cefoperazone plus sulbactam, ceftriaxone plus tazobactam. So these are the examples of potentiation, that is 1 plus 0 is greater than 1. Here the sulbactam or tazobactam is 0 and these antibiotics cephalosporins having action 1, and when they are combined the action of the antibiotics increases because the beta-lactamase is inhibited by the suicidal inhibitors like sulbactam or tazobactam. So this is an example of potentiation. So this is all about cephalosporin antibiotics. Thank you.